let's look at the origin of disease. This is, if you dissect the word disease, this and then is means the body is not at ease, right? Our body is composed of cells, tissues, and organs. Now, if we don't have the proper nutrients, and if we are surrounded by all these free radicals, such as the virus, the COVID right now, bacteria, parasites, and the factors I just mentioned earlier, that could damage our cells, our tissues, and eventually our organs, then it could damage our whole system, and diseases come in. Right? Okay, so let's do this. When doctor tells you that you or your family member has cancer, or your doctor will tell you, or your family member, you have 4 to 6 months to live. So what comes to your mind? What do you do? Some people think they are getting closer to their deathbed. Some prepare their last will and testament, right? Or their living trust. Talagang they're, hurry up ito. If you think about it, cancer is deadly, right? I read an article that says cancer is smarter than we are. In fact, is winning the war. The first question we need to ask is why we get cancer in the first place. They say cancer is a disease of aging. But according to research, it shows that this is very important. Cancer develops due to failure of the immune system. And you know that cancer has one job. What is that? To survive. In order for cancer cells to survive, they must evade elimination from the patient's immune system, the body's immune system, which is a network of organs. A network of tissues, and specialized cells that protects the body from infections and other health conditions. Although the immune system normally removes damaged or abnormal cells from the body, some cancer cells are able to hide from the immune system. Smart nga di ba? So actually, cancer, this topic is very broad, health conditions that many are affected. But for today, let's talk about the basics of cancer. If there is nursing 101, let's do the cancer 101, and then we'll talk some of these topics later. No. So what is cancer? No. The word cancer comes from the word. It's a Latin word actually. A Latin word for crab. Ano ba yan? Crab, talangka, no? That describes the crab-like invasion. Look at the screen. May mga, ano bang tawag dyan? Kamay, no? What happened here is that abnormal cells divide without control and can invade the nearby tissues. And most cancers form tumors, but not all tumors are cancerous. Diba? Cancer cells can only spread to other parts of the body through blood and lymphatic system, yung mga lymph nodes po natin. Yan. Cancer can start almost anywhere in the body. Our body is made of trillions of cells, but normally human cells grow and divide to form new cells as our body needs them. When these cells grow old or become damaged, they die and new cells takes their place. But when cancer develops, this orderly process breaks down. And as cells breaks down, more and more abnormal, all damaged cells survive when they should die. Dapat mamamatay sila. Mamamatay sila, but they keep on multiply, they survive, and new cells form when they are not needed, diba? So these extra cells can divide without stopping. Walang hihinto yan, and may form growth cell. What do you call that? They call them tumors, which are masses, yung parang mass of tissues. But there is a cancer of the blood, such as leukemia, that generally do not form solid tumors. Yan. Here in this slide, you can see the difference between a normal cell and a cancer cell. Just the appearance in itself, normal cells are regular, the blue ones. Look at the shape on the top. The shape or the appearance are regular. The cancer cells are irregular. They varies in shape, no? The nucleus, the inside circle. Normal for normal cells, it's proportionate size. Cancer cells are large and darker. The normal cells, they require oxygen. Cancer cells, they don't require oxygen. The normal cells, they require some glucose. But cancer cells, ito maganda, love and crave for glucose. The environment for normal cells is alkaline. For cancer, it's acidic, no? So I have more slides about the comparison between normal and cancer cells. The normal cells produce themselves and then they stop growing or stop reproducing when enough cells are present. Example, if cells are being produced to repair a cut in your skin, new cells are no longer produced when there are enough cells present to fill the hole, no? When the repair work is done. But with cancer, don't mature because they reproduce rapidly before the cells have a chance to mature, meaning cancer cells don't stop growing even where there are already enough cells present, no? Continuous pa rin yan. That's why I said earlier there's a tumor formation. Normal cells also mature, but cancer cells, on the other hand, they don't. They grow rapidly, they divide before cells are fully mature. They remain immature, kumbaga, no? And another way of explaining this is cancer cells are cells that don't grow up. They don't specialize into an adult cell. Sometimes we hear stage 1, stage 2, stage 3, stage 4, depending on the amount of abnormality. In stage, when they say stage 1, the tumor cells and the organization of the tissues appear close to normal, parang normal lang siya. But these tumors tend to grow and spread slowly. But let's say in the case of stage 4 cancer is not curable. But that doesn't mean that there is no effective treatment. Stage 4 cancer is the severest, I'm not sure if that's a word, severest form of cancer. It has the highest risk of mortality or death. However, stage 4 cancer is not always terminal. You know, normal cells also, the normal cells, they respond, they communicate, they respond to signals sent from another nearby cells that say essentially you've reached your boundary. So then when that signal comes in and they hear that cell signal, they stop growing. But cancer cells don't. They don't interact with the other cells as normal cells do. Okay? They don't respond to any signals. Normal cells, they secrete substance that make them stick together in group. Cancer cells fail to make this substance and they can float away. Nagfo-float yan to locations nearby, or they float through the bloodstream, no? Or bloodstream or system, the lymphatic channel, the lymph nodes, no? To distant regions of the body. So that normal cells, they stay in the area of the body where they belong. For example, lung cells remain in the lungs, but some cancer cells may lack that adhesion molecules that causes stickiness and are able to detach, and they travel by the bloodstream and the lymphatic system to other parts of the body. So they have the ability, these cancer cells have the ability to metastasize or spread. Okay? So once they arrive in a new area, bawa ko lymph nodes, liver, they begin to grow. They often form, again, another tumor na naman on that far from the original tumor. Di ba? So yan, meron din siya invasiveness. Normal cells listen to signals from neighboring cells. They, what do you call this? They stop growing when they encroach on nearby tissues. While cancer cells, ano yan, they just ignore, walang pakialam to the cells and they just invade nearby tissues. Maano siya masyado siyang matalino. She keeps on going anywhere. They're trying to invade the whole body. Normal cells are either, they are either repaired or they die when they are damaged or when they get old. While cancer cells are either they don't repair and they just ignore the signals that the body uses to get rid of unneeded cells, no? So, if you have been diagnosed with a tumor, the first step your doctor will take is to find out what is if it is malignant or benign, right? As this will affect the treatment plan. A tumor, let me give you the difference between what is malignant and malignant. A tumor is an abnormal lump or growth of the normal cells. When the cells in the tumor are normal, then that's what we call benign. But if it's malignant, it is when these cells are abnormal and they cannot stop growing and they cannot stop multiplying and they invade nearby tissues. Metastatic, they go around when some cancer cells move into the bloodstream. Parang nagre-repeat lang ako pero because it's they spread talaga. They try to invade the whole body talaga. So there are different types of cancer. Ayan, no? Cancer can grow. Sabi ko kanina, they can grow and can start in any parts of the body depending on what part is affected. Like example, carcinoma, breast, colon, prostate, sarcoma. Ayan, yung mga vessels, ligaments, mga bones, leukemia, that's from the blood. Lymphoma, mga lymph nodes, melanoma. These are the terms that you will hear from doctors when they talk to you about cancer, no? Melanoma, the brain and for the skin, meron ding cancer of the spine and the brain, no? So what are the risk factors of cancer? We have a lot, but I only pull at least 10. Diet, lifestyle, obesity, infectious agent like the virus, mga bacteria, pollution, radiation, sunlight, immunosuppression agents, age, kasama pala yan, hormones, no? But there are a lot of risk factors of cancer, but for today's discussion, let's just do the first 3. Diet. Kasi masyadong, if you look at the pictures earlier, alcohol, drinking, smoking, at saka ano pa yan, junk food, ano? So diet, remember earlier these unhealthy foods, junk foods, the one example of something that has in our junk food is acrylamide, for example, is a chemical found in tobacco, found in smoke and some foods. It can produce it can produce when certain vegetables such as like potatoes, ayan, yung potato chip, french fries are heated to high temperature. We also have example artificial sweeteners. According to studies, the artificial sweeteners including saccharin, including aspartame can cause cancer. We also have the charred meat, no? Certain chemicals are formed when the muscle meat, including beef, including pork, fish, and poultry is cooked using high temperature methods. Yung talagang painit, deep frying, di ba? So, second is the lifestyle. Ayan, tobacco. Tobacco use is the leading cause of cancer and of death from cancer. You know, people who use tobacco products or are exposed, like these are the second smokers, exposure, have an increased risk of cancer because tobacco products and the second-hand smoke have many chemicals that damage the DNA, no? You know, tobacco use causes many types of cancer, including cancer of the lungs, cancer of the larynx. Ayan, nakikita nyo po dyan sa screen natin, yung lungs ng healthy and lung cancer. No? Esophagus can also be affected. Throat, may throat cancer of the throat, cancer of the bladder. Tignan nyo, imagine nyo, smoking, tapos it's the kidney also is affected, liver, stomach, lahat na lang yata, no? People who use smokeless tobacco, mga Viper na yan, yung, what do you call that, sister, yung, the parang tinu-chew nila, tobacco, chewing tobacco, have risk of cancer of the mouth and esophagus and pancreas.
Yeah.
There is really no safe level of tobacco use. So if you smoke, regardless of your age, ayan, I strongly urge you quit because you have substantial gains in life expectancy compared with those who continue to smoke. Also, quitting smoking at this time of cancer diagnosis reduces the risk of death. Ayan, diba? So I really encourage, to quit na. Talaga, if you still want to live longer. Another one is for the lifestyle, I pull this alcohol. Drinking alcohol can increase the risk of cancer of the mouth. Yan. Throat, esophagus, yung voice box natin. Voice box kasi, diba? And then breast cancer. The more you drink, the higher your risk of cancer. The risk of cancer is much higher for those who drink and at the same time use or smoke tobacco. Diba? Kasi doble eh. Just drink moderate in amount. Ayan. Meaning take 1 drink per day for women and up to 2 drinks per day for men. Ayan. So the third factor that I pull is the obesity. People who are obese may have increased risk of several types of cancer, including cancer of the breast. In women who have been through menopause, mga colon cancer, rectal cancer, endometriosis, like the lining of the uterus, esophagus, ayan, mga pancreas, it's all it all can get cancer. On the other hand, if eating a healthy diet, being physically active, keeping a healthy weight may also reduce the risk of cancer. Okay, so ayan. Most common cancer in the US. Number 1 is lung cancer. Ayan, no, lung cancer, breast cancer, colorectal, prostate, skin, stomach. But lung cancer is number 1, but secondly, cancer was the second. In 2019, cancer was the second leading cause of death after heart disease. But lung cancer is the number 1 leading cause of death among other cancer in the US in 2019, no? Breast cancer, kung titignan natin the screen, breast cancer is number 2 most common type of cancer. But breast cancer patients live longer, sometimes 5, 10, 15, 20 or more years than colon cancer or lung cancer. Bakit? Because colon cancer, lung cancer, mga pancreatic cancer, when symptoms appear or they are detected, they're already in the advanced stage. No? Kumbaga, stage 4 na agad. Kasi walang symptoms nagmamanifest right away. Pag minsan is already nagmetastasize na siya. So according to CDC, Centers for Disease Control and Prevention, sabi nga, lung cancer is the leading cause of cancer death. Ayan. This is the statistics that I got. No? Cancer. Ayan. So signs and symptoms of cancer depends on the area, body parts that is affected. But sometimes, there's a chronic cough if it's lung, wheezing, chest pain, bone pain. Sometimes if it's breast, there's lump, there is the lipol discharge, mga ganyan, no? So there's an unexplained weight loss. But marami pa, there's a lot of symptoms. So maybe later in my talk I can talk to more on that. So what are the treatment? Most of the time, ito yung mga treatments natin. I mean, on a common surgery, they remove the tumor, they remove the cancer. Then, patient will go into chemotherapy, in may infusion or oral radiation, and immunotherapy. No? So, when a person is diagnosed with diseases such as cancer, most patients on chemo experience, they experience side effects like nausea, vomiting, body weakness. So, and other than the chemo drugs that they take. So, according to Dr. William Osler, the person who takes medicine must recover twice, once from the disease and once from the medicine. So, what should we do? We need to protect ourselves, isn't it? So, we need to protect ourselves, not tomorrow, not the next day, but now. And how do we protect ourselves? We need to eat right, fruits and vegetables. We are literally what we eat, Every cells in our body that makes up the organs, create hormones and enzymes that makes us function. And these are created by the nutrients we take in through the food we eat. So if this is being compromised due to poor diet, poor digestion, the side effect could affect our body. Tama? So according to Hippocrates, let your food be your medicine and your medicine be your food. But how? Let's look at the food guide pyramid in this slide. According to World Health Organization, eating right is taking 5 to 6 servings of fruits and vegetable. Or 100 kilos. Ayan, ang dami, no? 100 kilos per year, 8 to 10 kilos per month. Kaya ba yan? Ha? But nowadays, it's different. We have the inverted pyramid. What do I mean by this? If you give or serve your child with fruits and vegetables and a plate of French fries, what will he choose? Diba French fries?
Of course, French fries and burger.
So, talagang, but who bought that French fries and who bought that burger? The mommy, right? The parents.
Mommy and daddy.
Yes, so we need to watch what we give our children. Talaga.